Hi, and welcome to your Rhinoplasty pre-op. My name is Hillary, and I am the pre-op specialist here at Dr. Karam's office. We are so happy that you chose to do your rhinoplasty with Dr. Karam, and you're going to have a beautiful result. So you will be receiving a package in the mail from us. It is going to have the vitamins that you will start taking before surgery. It will also have the pre and post-op guide that we will go through today that is going to have all the information that you need for surgery. So let's get started. Now we are going to talk about preparing you for surgery. So things that you need to purchase from the store. So what you need to get, number one, is some surgical tape. Super easy to find at any drugstore in the first aid area. You will need to get hydrogen peroxide right here, Dial antibacterial soap, which is going to look like this. This is not Dial, but it's going to be an orange bottle or blue, very similar to this, super easy to find as well. And you'll also need to purchase Aquaphor. So this is another thing that you can find at the drugstore, super easy to find. So 2 weeks before surgery, we need you to discontinue using anything except Tylenol for pain management. Make sure that you don't smoke for 4 weeks before surgery. And if you do smoke, make sure you disclose that information during your pre-op appointment with us. No alcohol for 2 weeks before surgery, 2 weeks after surgery, and vitamins. So any vitamins that you normally take, we're gonna have you stop taking those and start taking the vitamins that Dr. Karam has provided for you. Dr. Karam has made an amazing protocol with vitamins for you to heal quickly after surgery, and we are gonna go through them right now. So 2 weeks before surgery, you are going to start the protocol. All you're gonna do 2 weeks before surgery is start taking your clinical support vitamins. So you will be receiving a morning formula vitamin and an evening formula vitamin. So you are going to take 3 of the morning formula vitamins with breakfast and then 3 of the evening formula vitamins with dinner. You start these 2 weeks before. 10 days before, you are going to add in the vitamin K. The vitamin K, you are going to take 10 pills 10 days before. I always recommend taking 5 with breakfast and 5 with dinner, or you could do 3 with breakfast, 3 with lunch, 4 with dinner, however you want to do it, so you split it up so you're not taking all 10 at once. And then 3 days before surgery, you are going to add in the last 2. We have bromelain. You're going to take 2 pills 3 times a day. We prefer you take this in between meals. And then you're going to take the arnica, 3 pills 3 times a day, and these will dissolve underneath your tongue. So you will not take any vitamins the day of surgery, and then the day after surgery, you will continue taking the vitamins, all of them except for vitamin K. That is only for before surgery, and then the rest of them, you will take them until the bottle runs out. And if you have any questions about what these vitamins are for, it is found in the pre and post-op packet that you will be getting in the mail. The day before surgery, so exciting, it's almost here. There's a couple things that you need to do to prepare for surgery the day before. So what you need to do is make sure you start taking your antibiotic that Dr. Karam has provided, that we will be picking up from the pharmacy. You're going to start taking that the day before surgery, and this is here to prevent there from being any infection after surgery is over. If you have a history of cold sores, we're going to put you on an antiviral as well, and you will start that the day before surgery. If you do have a little bit of elevated blood pressure, no problem. We are going to put you on a blood pressure medication that you will start taking the week before surgery. Going into the morning of surgery, you are going to make sure that you don't eat or drink anything for 8 hours before you arrive. No food, no water, nothing at all. You are also going to make sure that you wash your face and your neck with the Dial antibacterial soap. So you are going to wash your face and neck with the Dial antibacterial soap the night before surgery and the morning of surgery. So 2 times. When you get out of the shower, the morning of surgery, make sure that you do not put on any lotion or any makeup. So when you arrive here, I would come with really comfortable clothes on. Personally, I would wear a zip-up jacket or a button-up shirt so you don't have to worry about pulling anything over your head after surgery's over. Make sure that you come with no jewelry on, and also if you do wear contact lenses, make sure that if you want, you can come with them on, but make sure that you take them out before surgery. So we recommend just coming without them on. Okay. You are going to be leaving the surgical center. After surgery is over, you are going to have a white cast right here on the nose that will be there for 7 days. It is extremely, extremely important to make sure that you keep the cast super dry. If the cast gets wet, it could fall off prematurely. So make sure you keep the cast dry when you're showering or bathing. So you can take a shower at 48 hours after surgery, wash your hair. Make sure that when you're doing that, you block off this area so water does not reach the cast. I recommend if you do have a bath, to take a bath the first week. It's a lot easier to wash your hair when you can just dip your head back instead of having the shower. If not, the shower is totally fine, and there's ways to make sure that you keep the cast dry. You'll also be leaving with that drip pad underneath your nose as well. So those are the two things that you will have on the face when you leave surgery. Super important to note, when you come in for your 7-day post-op, right before you come into the office, you need to get your cast very wet. So run your head under the shower head, get it wet, rinse your face off. So when you come into the office, the cast is nice and loose so it doesn't feel uncomfortable to take it off at that appointment 7 days after. Once you come in for the 7-day post-op, we'll take your cast off. It's super exciting. Everyone loves it. It's the most fun day. We're really excited to be a part of this experience with you. And then once you leave, you'll come back in for a 1-month post-op. We'll take photos. You'll chat with Dr. Karam. And if you are coming from out of town and you cannot make that appointment, no problem at all. We'll do it virtually. So Dr. Karam will go ahead and he'll FaceTime you. We're going to talk about what to expect when surgery is over. So you will notice that you'll have swelling and bruising. This is extremely normal after rhinoplasty. The bruising typically right here, and then the swelling, of course, around here. Sometimes, right here, the upper lip. The upper lip can also become numb. And then on day 7, when you get your cast taken off, your nose will be swollen and it will swell a little bit more once the cast is removed. And this is extremely normal. And I always say the rhinoplasty is kind of like the gift that keeps on giving, because with time, the nose will continue to shrink with the swelling. So you will see your final result typically a couple months after surgery. That's not to say that your nose is not going to look amazing, but it just takes a little time for the swelling to go down. It's extremely normal. Some people experience a sore throat after surgery. This is extremely normal. It's because when you're under general anesthesia, the tube right here, when it's taken out, sometimes it can just make the throat feel a little sore. Totally normal, nothing to worry about. With pain, I would say some people feel a little pain for a couple of days post-surgery, nothing severe, but we do give you pain medication. So if you do feel like you need it, you can definitely take it. Some people will just hop over to Tylenol instead. And the general feedback I get is that people don't necessarily feel a lot of pain after surgery, just more congestion. And so that can cause people to feel a little uncomfortable, but it's not as bad as it sounds like it's gonna be. And bleeding. So once surgery is over, you are going to leave the office with a cast on your nose and a drip pad underneath your nose and tape on the sides of your face. So you will be changing that out on your own. So all you do is get the gauze that we've given you in your package, you fold it in half, you put it underneath your nose, and the tape that you purchased from the store, you're going to tape it on the sides of the face. So this pad will catch some of the extra fluid that will come out from the nose. Typically, this fluid, the bleeding, will be very sparse, very light, and you just have to change the drip pad out, I would say a couple of times a day. If you do notice that you are saturating the pad heavily every 30 minutes, make sure that you call Dr. Karam or the office, because that's just too much blood. We want to keep an eye on that. With the drip pad, you usually only need it for about 48 hours, not longer than that. Because you're going under general anesthesia, you may feel a little nauseous when you wake up. which is normal. So making sure that you have food prepared, soft foods prepared, soups, mashed potatoes, smoothies, things like that, things that are not going to be hard to chew. Go ahead and eat those right when surgery is over to fill up your stomach. And also, we are giving you a prescription to Zofran, so that will help take away the nausea immediately if you are feeling that. My advice to people who do get a little more nauseous, I would take the Zofran 30 minutes before any pain medication for the first couple of days, so your stomach does not react, so you do not get nauseous when you take the pain medication. Now we're going to discuss how to clean everything after surgery is over. So what you're gonna do is you're going to grab Q-tips, you are going to dip it in hydrogen peroxide, and you're going to clean the base of the nose right here. And when you do this, it just helps get rid of any dried blood, any buildup right there. Do this 2 times a day. When you're done cleaning the base of the nostrils, make sure that you get a little Aquaphor and just put this on the base of the nostrils to keep it moist so blood doesn't start to build up. Also, you are going to take this saline nose spray that you will find in your package. You are going to spray it in each nostril a couple times. Make sure you keep everything very upright, no bending down like this, and go ahead and I would do it over a sink. Spray in each nostril a couple times and just let it drain out. Don't sniff or blow, so just let it drain out. Get a little tissue and blot it. This is just gonna keep everything moving. So you do this the day after surgery 3 to 4 times a day. Just to talk a little bit more about some post-op instructions, so super important that you know with sunglasses or reading glasses, you cannot wear them for 4 weeks after surgery is over. Unfortunately, you have to wait, as well as exercise. So you can walk very slowly, like a stroll, a couple days after surgery, very light walking. That's the only exercise that you can do until you get to your 4-week post-op. Once you get to that appointment, you can start back to your normal exercise routine. Before that, slow walking, totally fine. Just make sure it's slow, the duration is not long, and you are not getting your heart rate up at all. With bending over, all of that, very important to make sure that you stay very upright. When you are texting, make sure that you're not going like this. Bring your phone up. Watching TV, make sure you keep everything up. You don't want to do anything where you're straining. It could cause there to be more blood flow to this area, as well as lifting anything, heavy boxes, doing the dishes the first week, nothing where your head is going to be going down and up. We need everything to stay upright. And that brings me to sleeping. So extremely important for you to make sure that you sleep elevated and you sleep on your back. With the back, sometimes people have a little trouble because they're used to sleeping on their side. So I recommend practicing a couple weeks before surgery so you feel comfortable sleeping on your back during your post-op. Thank you so much for taking the time out of your day to watch this video. I hope it helped a lot. Remember, we will be meeting in person or over the phone to go over all of this together, and I will be here to answer any questions that you have. And we are so excited for your upcoming procedure. We look forward to seeing you soon. Bye.